Welcome to the Health Daily Show. I'm your host, Chitra Nabat. Joining us today is LaShonda Anderson-Williams, Executive Vice President, Chief Revenue Officer, Healthcare and Life Sciences, Salesforce. Shonda, welcome. Thank you for joining us.
Chitra, how are you?
I am good.
Look at this place.
Fantastic, right?
Yes. Glad to be back.
And everyone here is going to want to know, Shonda, Healthcare and Life Sciences at Salesforce, what exactly is this business?
Well, I'm so glad you asked. Well, let me just say, we are ecstatic to be here. Salesforce and life sciences and healthcare is not a new thing for our company. Salesforce has been in the healthcare and life sciences industry for over 20 plus years. What you're now noticing is we have a very specific unified point of view on how we're going to deliver healthcare and life sciences solutions to the entire ecosystem. And I just want to point out, what that means for us is using our technology and applying it to these various ecosystems to improve how healthcare is delivered. It's just that simple. And we have a team of salespeople, industry experts, marketing teams, engineering teams, product teams. We have an entire community of people focused every single day on improving how health is delivered by each ecosystem leader in the payer, medical technology, pharmaceutical, and healthcare versions, how we actually apply that to make the lives of all of us even better.
Can you give us some use cases to bring it to life for us? Use cases at scale.
Yeah, I mean, there are so many things. Most recently, I spoke to Moderna and I spoke to CVS. So two opposite ends of, I think, the ecosystem and how we can help improve patient access through companies like Moderna and specifically things like call center, being able to allow them to move quickly in areas around the world to create operational excellence. And CVS, they have huge call centers as well, and we are powering their business. And the third example, I'd say, beyond Moderna and CVS is Humana, another part of the ecosystem where we're powering their care team. So we're using our technology to power use cases and outcomes, just using technology. And more importantly, we're helping each one of those partners, what we call customers, our partners, help transition to digital, more modern, cost-efficient, and automation solutions around the world.
Powering their care teams,
yes.
What you just talked about. Can you just even go a little bit more, double click, triple click, like walk us through a little bit of the steps? And the reason why is because so many technology companies, a lot of the same words, you would think that others do the same thing, but you're different. So if you could walk us through a little bit more.
What that means for us is very unique to Salesforce. We put the patient or the healthcare professional in the center. Empowering means giving them the technology so that simple things like scheduling, self-service scheduling. Self-service is a big deal in the call center so that you don't have to employ a number of agents to pick up phones, you have dead calls. We're really using our technology to automate simple steps to helping people get the care they need when they need. And so the other example I would give you is at Humana, care coordination, and allowing care team members to have access to the patient and member information consistently through that patient's care journey, and using automated technology to help make sure that we're stitching together each one of those plans so that wherever they are in their journey, information is used at the point of care. And that's what Salesforce does very, very well.
You're at a tough intersection.
Yes.
The last year for Salesforce, stock down 50%. You serve the healthcare and life sciences industry. Very challenging macroeconomic headwinds, especially in the provider space, right? Depressed and negative margins. But healthcare broadly, customers have got to get a lot more ROI out of their investments.
Yes.
How does your healthcare business drive the growth equation at Salesforce?
I think, well, look, all of us are feeling the same challenges that our customers are. And it's not just healthcare, it's the entire ecosystem. And what you probably have seen is retail organizations jumping into this industry. Why? Because we believe that there is a future, and a very bright future, that when we can use the best of breed capabilities across other verticals or industries, and we can apply them to health, we can actually deliver better health outcomes. And what that means for us is we're using our technology to fuel innovation and efficiency, and realizing how we can take costs out of the model while keeping things connected, more digital, and more importantly, frictionless, so that we, all of us around the world, can get better care when we need it, how we need it.
You have expanded partnerships with AWS, others like Meta, Snowflake. What does this really mean? How is this going to be a differentiator on serving healthcare?
I will be the first to say, and everyone in Salesforce will also say, we can't solve it by ourselves. So the best thing we can do is look to leaders across the industry, and every one of those organizations that you mentioned and many, many more. Our customers are using them in their own environment. The best thing we can do is find a way to lock arms with them and use the power of our capabilities, connect it with some of our peers in the industry, and help improve how health is delivered. So it's not a new thing, but we're looking at those partners as a way to help accelerate better access to care for our customers, but more importantly, it still goes back to Tricia, putting the patient, the health member in the center. When we do that with the ecosystem, we're going to make a difference in this world.
Many of the digital health startups, the founders at this conference, they all pitch you that they have add-on capabilities that can be complementary to your healthcare offering. What are the metrics, the attributes that you look for you to partner with one of these founders?
It's pretty simple. One, we love companies who are as excited and committed to driving care and access. What we look for is organizations who are bringing value. And value for us is meaning how their technology, when combined with our technology to a customer or patient or member experience, can help drive outcomes, better health outcomes. That's the metric. The metric is how do we provide value? And if you're thinking about the provider business we just talked about that is very challenged with the market economics, how do we actually take cost out? So metrics on how do we help drive more efficiency in each one of these care experiences. And that's some of the things we're talking to many of these organizations today is how their technology, when partnered with Salesforce, can help drive efficiency, automation, but better outcomes for health providers.
Are there specific tools, technologies from these founders that you're looking for?
It's all. So it's telehealth. Tele is a big thing. You should be able to get care from anywhere around the world. It's how do we bring data together at an aggregated level to help create a unified view of how a patient's experience can be frictionless, more connected, and more importantly, digital. We should not, as patients, have to bring our own medical records to our doctors and tell them what we need. That should be automated. If we can have technology providers that do that with our technology, we're absolutely interested in talking to them.
Leadership.
Yes.
In career, business life, there are many rules, codes, norms to how things are done. Mm-hmm. Where have you been a code breaker in career or business? Mm-hmm. How did you do it?
Well, we have this saying in my family, and you talked about some of the headwinds. It's very easy to look at the headwinds and say, boy, it's going to be hard, can we do it? And this thing we say in our family is, if you think you can, you can. If you think you can't, we can't. And at Salesforce, we believe we can. And so where have I done it? I'm doing it every day with our teams, with our customers, with our partners. And that to me is something unique that when we look at this industry, it's very, very hard to not get excited because we see the possibility, and more importantly, we see the opportunities ahead, and we believe we can, and we will.
Shonda, thank you so much for joining us.
Absolutely. Thanks, Chitra.